In this video, I am going to demonstrate how you can simply load and prepare any antibiotic injection. So in today's video, I'm gonna use amoxiclav 1.2 milligram. So in this video, I am going to show you a step-by-step method in which you can simply reconstitute or dilute so that you can load an antibiotic injection. So in today's video, we shall be using the amoxiclav 1.2 milligram. Okay, before you start, make sure that you clean your working bench. So ensure that first make sure you clean your working bench. To maintain sterility of the drug, make sure you clean your working bench first before you start loading the injection or reconstituting the drug. First, make sure you clean your working bench. So this is how you are going to perform. Ensure that you clean your working bench first. After you have cleaned your surface, then what you do, make sure you gather all the supplies that you require for you to prepare the drug. For instance, you may need amoxiclav 1.2 milligram for you to prepare. Okay, you will need a syringe. So you will need a syringe of 20 ml. You will require a syringe that is 20 mils. Okay, you will need a 21 gauge needle for you to withdraw the drug or maybe to reconstitute the drug. So you will need an alcohol swabs. So this is an alcohol swabs in which you will clean the opening of the vial before you start diluting the drug. Okay, let us start. Now let us see brief overview of the amoxiclav. Make sure you open the packaging of the drug. So this is what you will observe. So this is amoxiclav. Let us proceed now. What you do before you start diluting the drug, make sure you check the expiry date of the drug. For example, expiry date is June 2026. So make sure that you check the expiry date of the drug. Then what you do, make sure method of administration, for example, for IV use only. So in this drug, you can only administer through IV use only. So make sure that you check method of administration. Then what you do, you will also need to check method of diluent. For example, a sterile water for injection BB 20 ml. So you are supposed to reconstitute the drug with 20 ml of sterile water for injection or 0.9% of sodium chloride. Let us start now. What you do, you get the drug. So you get the drug. Make sure that you check the labeling of the drug. For instances, you have to check the labeling of the drug. That is the expiry date of the drug. For instances, the expiry date is June 2026. Then what you do, make sure you also check method of administration, that is for IV use only. So in this case, you cannot administer through IM route, but you can only administer through slow IV use or maybe slowly infusion. So that is how you are going to administer. Then what to do, make sure you open the packaging of the drug. So you open the packaging. This is what you will see. So this is the 20 ml of sterile water for injection. You can also use 0.9% of sodium chloride. And this is the white border containing 1.2 milligram of amoxiclav. And this is the packaging, that is the leaflet. And this is the leaflet that contains all the instructions that you require for you to follow so that you can easily perform the procedure. So make sure that you read the leaflet of the drug. Make sure you check how it is administered, method of diluent, then the side effects and precautions. This is where you can find all that information. So when you look at this is antibiotic, that is which falls under the group of penicillin. So it is antibiotics which is antibacterial. We use it to to treat a number of infections. For instance, is urinary tract infection, infection of the middle ear, infection of the upper respiratory tract infection, infection of the genitals. So we use it to treat a number of severe bacterial infections. Okay, let us now start. Then what you do, make sure you get the syringe. Then you open it from the packaging. You open the syringe. Make sure you remove the syringe from the packaging. Then what you do, you get a 21 gauge needle. So you get a 21 gauge needle. Then you attach the needle into the syringe. Then what you do, you put back it into the packaging to maintain the sterility of the syringe. Then you get the sterile water for injection containing in the plastic vial. You open it. Then what you do, you get an alcohol swabs. Then you clean the opening of the plastic vial. Make sure you clean the opening of the plastic vial before you start withdrawing the water for injection. Then you get the syringe, you remove the needle. Then what you do, you withdraw all the sterile water for injection. So this is how you are going to withdraw. Make sure that you withdraw all the sterile water for injection. Then you inject it into the vial containing the 1.2 milligram of amoxicillin. Then what you do, make sure you remove any air bubble. Then you put back the cap of the needle to maintain the sterility of the syringe. Then you put back the syringe into the packaging. Then you get the amoxicillin. Then you flip off the lid of the vial. Then you get an alcohol swabs. So this is an alcohol swabs. Then you make sure you clean the opening of the lid to maintain the sterility of the drug. Make sure you clean the opening of the vial for 20 seconds and you allow it to dry for 30 seconds. So make sure you clean the opening of the vial 20 seconds and you allow it to dry for 30 seconds. Then what you do, you get the syringe from the packaging. Then make sure you remove the cap of the needle. Then you inject it into the vial. Then what you do, you transfer all the sterile water for injection into the vial. So this is how you are going to reconstitute the drug. Then what you do, you release to allow air bubble into the syringe. Then again you squeeze it, you push it gently. Then again you allow it air bubble into the syringe. Then again you gently push the plunger to reconstitute the drug. Make sure that all the drug is completely dissolved. Then you allow air into the syringe. Then again you push gently the plunger to make sure you dissolve all the drug. Then what you do, make sure you check the vial gently like this until all the drug is completely dissolved. Make sure you check the vial gently like this until all the drug is completely dissolved. I hope you can see. Then what you do, you push the plunger gently, allowing, make sure you put it all. Then what you do, you remove the needle from the vial. Then you allow it to settle for some time. Then you put back the cap of the needle to maintain the sterility of the drug. Then what you do, you shake it gently. So make sure you shake the vial gently to make sure that all the drug is completely dissolved. Then what you do, you change the needle. Now this is how you are going to withdraw the drug from the vial. You attach the needle into the syringe. Then what you do, make sure before you start withdrawing the drug, ensure that you put equal amount of air bubbles. So make sure that you put equal amount of air bubbles into the vial before you start withdrawing the drug. Then what you do, you remove the cap of the needle. Make sure first you put equal amount of air into the vial. So you remove the cap of the needle, you inject air bubbles into the vial. So you put air bubble into the vial. Then what you do, you hold the vial horizontally. Then make sure you withdraw all the drug from the vial. So it's very simple. This is how you are going to withdraw. Make sure you keep the needle in line with the drug to avoid air bubble rushing into the syringe. So this is how you are going to withdraw the drug from the vial. So when you finish, make sure you remove the needle from the vial. Then what you do, you remove any air bubble. Make sure that you remove any air bubble from the syringe. Then what you do, you put back the cap of the needle. When you finish diluting the drug, then make sure you label the drug. Make sure that you label the drug. You label the drug. Then what you do, you put the syringe from the packaging to maintain the stability of the drug. Then what you do, you go to the patient's documentation and make sure that you follow the 8 rights of drug administration. That is the right patient, right drug, right dose, right route, right time, right reason, and the right documentation. So this is how you're gonna prepare amoxicillin 1.2 milligram, and this is how you can simply load any antibiotic injection. So I hope you find the video very helpful. Kindly please don't forget to hit the subscribe button, like and share, and give your comment to this video. Thanks for your watching, and see you in the next video.